Hi, John. Good to see you.
Hi, Paul.
Um, so we just sort of started to do a bit of reflecting about all of the massive change we've been through, and I was wondering about some of the stuff that we just, is so good that we don't want to go back on it. Have you got a take on some of that?
It's been quite staggering, really. If we just think back to probably no more than sort of 5 or 6 weeks ago, we were still in sort of normal working mode. And what we've processed and committed to since then has been phenomenal. And I think the phenomenal bit has been how staff from across the whole of the organisation have been 100% behind it and contributing and passionate and coming up with ideas that we've been able to harness. Whereas traditionally, for whatever reason, all sorts of different reasons, we've been a bit stuck in the mud on things, whether it's a bureaucratic process or a bit bogged down in governance, or we haven't got proper engagement routes to access staff's ideas and thoughts and plans. It really has been quite amazing.
Absolutely. And I think that certainly from where I'm sitting, that need for us to be able to take big decisions much, much quicker than we've been used to has felt at times a bit risky, but also actually part of the excitement. And I think that a big element of that has been us just trusting our staff to get on and do things, and not trying to tie it all up and say this is how to do it, but actually letting people get on. And I think our staff have been terrific in then responding with that, but we have then thought quite differently.
Yeah, and there's some obvious examples of that. So within the forensic division, they've constructed literally their own Nightingale hospital offer that could be a regional facility for secure patients with COVID. The community health services division have completely transformed their processes around patient flow to enable discharge out of the acute hospitals, which has been really bogged down in all sorts of challenges over many years. And some of the numbers that we're seeing today are just incomprehensible 4, 5, 6 weeks ago. And some of the work in mental health and learning disability services as well has been amazing. We've got some cohorting wards in MESOP services. We've got some really strong input into the mental health 24-hour 7-day crisis line, which is up and running from nothing. And the list could go on and on about what's been enabled, and we really need to make sure that the things that catalyse that and enable it to happen, that we don't lose.
And some of the contributions from our corporate teams as well have just been immense. The enabling of us to be able to have a meeting like this, conversation like this. Actually, again, a couple of months back, we would have, I think, found it really hard to get that sorted. And actually, our IT teams and others managed to sort that in a matter of days. And I know our HR teams and other corporate teams have been doing some really sterling work, helping us understand where our staff need to be. And also there's been those corporate staff who've had clinical backgrounds, who've stepped back into clinical roles, which has been phenomenal. But some of those tools, like the use of video calls, I think whilst I know we all crave being able to actually just get back in a room with people, actually they're a really important contribution. We know that in terms of the environment, people like me not driving around all the time actually makes a big difference. And whilst, of course, we need to make sure we go back to some of that being in the same rooms, I think we need to reflect on what we can do and sometimes can do better by these other tools.
Yeah, and it brings to mind to me that two of the specific values that we're starting to live around across the organisation. One is respect, and the other is teamwork. Yeah. And what you just described is a really good example of both. So respecting what each individual and each team can bring, but working collectively across corporate clinical services to come up with the best response to the challenges that we've had. And you correctly identify that the digital and IT. Traditionally we'd still be at the scoping stage before we had a long discussion about what the terms of reference for the project group was going to be, and we'd be literally months and years away. But the IT digital teams have sorted it, and we're here now talking like this. But not to miss out some of the amazing work that HR and workforce, that procurement, all our estates and facilities teams have again, I use the word transformed the way they've worked and the way that they've supported the clinical endeavour, which is our endpoint for patient delivery. It has been such a professional, committed and passionate response that we do have to capture it, and I'm really confident that we'll be able to do that.
Yeah, well, I'm looking forward to that. So just one other thought, John. I've seen some stuff on social media about people talking about the importance of us all looking after our own mental health, and I just thought we might share just a couple of things that are contributing to us doing our best to look after our own mental health. What sort of stuff have you been doing that contributes positively?
A stack of things, really. I'm fortunate in that I've always been fairly able to switch off. So if I'm not at work, I'm not at work. Although it's a bit more difficult with MS Teams because they track you down wherever you are, and obviously doing a bit more work at home. But no, it's important for people to find ways to do it, and everybody's different. But I particularly enjoy doing a bit of exercise. So I'm going on increasingly long runs at the weekend. I'm up to over 20 kilometres. Wow. That's where some of the oxygen's gone, because I need to carry it around with me. And I like a bit of cooking, a bit of reading, a bit of gardening, middle-aged pursuits, keep me sane. What about you?
Yeah, well, aside from actually reaching the point of letting my wife go at my hair with a brand new set of hair clippers, which was definitely a contribution to my mental health, as well as to, I think, other people's health looking at me over these video conferences. Big one for me is cooking, and it's something that I'm lucky enough to be able to sort of spend time in a kitchen and cook up dishes and just get lost in other people's recipes, which I'm one of those people who follows assiduously recipes. I know you don't, but I'm one who goes by, if it says quarter of a teaspoon, it's quarter of a teaspoon. And then my other passion, as you well know, is music. So I've been very deliberately listening to a lot of music and having that in the background in the home office that I'm working with. You can see some of it behind me there. That's really important part for me as well. So look, I'd better let you get back to some proper work, hadn't I?
Okay. Thanks very much. That was good.
Good to chat.
Cheers.
Bye.